Dr. Pete here. I wanted to talk to you specifically about estrogen and females fasting, because I think there's this inherent concern that if you fast, you will not be fertile, you will reduce your estrogen and, be less female and be less able to have a child. This would be a true concern if the fasting program that we were talking about lasted weeks and you were starving and malnourished. But remember, the Athos diet is a 24-hour routine, habit, way of life, where every day you're going between 16 and 20 hours without food, but you're getting all the proper nutrition, specifically the right, macronutrients and minerals and vitamins. So there really should be no concern whatsoever for fertility when you're doing the Athos diet at all. If anything, fasting actually has been shown to make estrogen receptors more sensitive to the signaling of estrogen. And as mentioned in other podcasts, estrogen might drop in a severely fasted state, but the refeeding syndrome, you get a boost of it. So there's a lot of things to consider here. But I want to really emphasize that being in a healthy weight as a result of taking your fasting routine seriously is good for you and is good for baby. Women who are obese or even overweight that go into their pregnancy oftentimes have gestational diabetes, gestational hypertension, eclampsia, preeclampsia. They are more prone to blood clots. When it comes to labor and delivery, oftentimes their babies are too large to pass through the birth canal, resulting in C-sections, even broken bones in the baby as the doctor is furiously trying to pull that baby out of the birth canal. It is a good idea to be in a healthy weight. And by the way, because we know that 80% of our genes are regulated to cues like light and when we eat, really sticking to a routine of eating, between 4 and 8 hours a day will work wonders for your metabolism and for your body signaling and for your fertility for that matter. So if you want to be more fertile, you need to fast every day. And if you want to have a healthier pregnancy and less risks of labor and delivery, fast every day. And specifically, remember that when you're fasting every day in this way, 16 to 20 hours, that means you're getting all the right nutrition during your eating window. The Athos diet is not a prolonged water fast of weeks. It's a daily fast with a specific window. And this is healthy for you and it's healthy for baby. And it's good for your estrogen, it's good for your estrogen receptors. You will be a healthier person as a result. And that all translates to you living 30 to 40% longer. The process wouldn't be beneficial overall in such a dramatic way if it didn't have daily improvements to your life now. A healthy person is a fertile person, is a person who's living a long time.